Hi everybody, welcome back to my channel. I'm sorry that it's been a month or so since I've made a video. Things have been crazy busy with work and just with life. Today's video is short. I just want to kind of talk about where I'm at in my head right now, revolving around my diabetes. My diabetes is awesome right now. I'm still doing great. You guys have seen my last videos. If you haven't, go back and watch my past videos, subscribe to the channel so that you can get more content. I'm still on track for another like 5.5 A1C according to what the Clarity app says on my Dexcom. And I'm just super excited about everything that's happening with my diabetes. With my life of my past, or the things that are going on in my life right now because of my past with diabetes, though, I made a video about not being able to see out of my left eye in the past, and this is coming back to me again. It's been a while now. It's probably been about 4 months, maybe more, that I haven't really had vision in my left eye. I have been only able to really see colors and like very like little bits of colors when I'm closing my right eye. So I went to the doctor. I thought my right eye was starting to get better, so I needed to get a new prescription. It had been a long time anyway since my last prescription. So I went to the doctor, I got my eyes checked, and the doctor at Nationwide Vision wanted to look into my eyes because they do a diabetic eye exam when I'm there because I elect to do it. Well, my left eye was so blocked that the doctor could not see into the eye to tell me what was going on. So she suggested that I go to a specialist, and I had that specialist appointment this last Tuesday. It was definitely not what I thought it was going to be. It was more of like a glorified Nationwide Vision. It wasn't like a specialist where they were going to be able to do these amazing scans that the doctor at Nationwide told me that was going to happen. So I was a little let down. I did get some good information from this doctor as far as like what actually is going on in my eye more, which I knew, but at least he took the time to tell me, and what some of the possible repercussions could be. So what's happening, what he thinks is happening, and it's hard to tell without being able to actually see in the back of my eye. So I'm going to make an appointment with a retinal specialist. Is that he just thinks my eye is filled with blood again. Now, this is what happened in the past. They were able to go in, do surgery, cauterize the blood vessels that are leaking, and drain the blood out of my eye, and then vision comes back. The problem in the past is that my A1Cs were terrible, and it kept making the blood vessels hemorrhage again and causing the problems. So ideally, right now with my A1Cs being a lot better, I'm going to be able to get this surgery again. I'm assuming that that's what the retinal specialist is going to tell me, is that a surgery is the only thing that's going to work, and that this time it might stay. This is the biggest hope that could happen. Even though the cost of the surgery is going to be a lot more now than it was 10 years ago, because everything is more expensive now than 10 years ago, or 8 years ago, or however long my last surgery was. And just transparency, my insurance isn't as good as it was back then. So we'll figure it out. There's no cost that I can't put on my health. So it is what it is. I'm going to take care of it. I'm going to get this done, and I'll keep you guys updated. The cons, the repercussions that could happen from this is at this moment, there is no pain in my eye. And the doctor did a pressure test on my eye, and the pressures in my eye are good. There's no pain, so everything's good. If the pressures start to increase and the pain happens, the first thing out of the doctor's mouth was, well, at that point, we'll have to take your eye out. And I said, okay, so let's figure this out a different way. And that's what we are now trying to figure out. So I'm going to make that appointment for a retinal specialist. My biggest concern, and this is, again, with the transparency that I try to always have with everybody. Over the years, with my vision going in and out of my left eye, I see better when I have full vision in my left eye and vision in my right eye, or I have almost no vision in my left eye and my right eye. If my vision in my left eye comes in and it's like half vision, it's very hard to focus with my right eye. So my fear of getting the surgery is that I get the surgery and I only have half vision, and then it's very difficult to see everything else that's happening around me because I'm trying to focus too hard and my right eye is really struggling. This is something that obviously I'm going to have conversations with the retinal specialist about, and we're going to figure out what the best course of action is. Again, I know that a lot of it's my fault. I know that I didn't take as good care of myself. When I said this to the doctor at the specialist doctor, he was very cool about saying, you didn't choose to have diabetes, which no, I didn't. But I also didn't choose to take as good a care of myself. I also wasn't given a lot of the information that I needed to do better with it. So I do take responsibility, but I do know that I could have had better information to help me to get to the point where I am at today. So I encourage anybody who's having trouble with their diabetes to really take control of it, really take it seriously, and to ask the questions that will help you grow. And any question is that question. If you need to know an answer to something, I might not know it, but there's a good chance I do. And I also know I have a large community of people. The Juicebox podcast is a large community of people that know a lot of stuff about diabetes because there's 50,000 people in that group. So somebody is going through the same thing you are in some form or another. There's places for you to ask these questions, and I encourage you to become a member of that group and to have the community around type 1 diabetes or just diabetes in general. I will talk to you guys soon on my next video, and I hope you guys have a great weekend. Thanks. Bye.